Now at 9, and your health care at risk. Thousands of Georgians could soon be forced to find a new doctor. A local hospital system and insurance provider at odds over your coverage. And time is running out with a year-end deadline looming. And if Northside Hospital and Anthem Blue Cross Blue Shield cannot find common ground, cannot make a deal, patients will be out of luck starting January 1st.
And while contract disputes are not new, CBS 46 investigative reporter Rachel Polanski finds they are becoming more common and impacting accessibility to your health care.
Behind all of this is a little kid with a really big heart.
I'm proud of him.
And a supportive mom.
He's come so far.
We know the story of this guy's heart.
What's the Grinch?
2 sizes too small. Mason's heart, it's a little bit different.
HLHS, as we call it. When you're born with half a heart.
He was born with a congenital heart defect called hyperplastic left heart syndrome.
So he had to have a series of heart surgeries.
The 10-year-old relies on the doctors at Northside Forsyth. That's why his mom, Tanya, was outraged when she found out her insurance company and hospital couldn't see eye to eye.
They told me that as of December 31st, that they would be out of network and they would no longer be taking the insurance.
And the Langs are part of 400,000 Georgians who will have to find new providers if Northside Hospital Systems and Anthem Blue Cross Blue Shield do not come to an agreement by the end of the month. Now comes the finger pointing. As Northside tells CBS 46 investigates, this decision surprised us. Our agreements with Anthem were not up for renewal and were not set to expire. Meanwhile, Anthem Blue Cross Blue Shield said Northside is one of the most expensive systems in Georgia, and the current contract does not adequately align incentives to improve quality and affordability for our members.
We've yet to see costs go down for consumers when hospitals merge. What happens when there's less competition? Always happens. Prices go up.
Liz Coyle, who heads consumer advocacy agency Georgia Watch, says we're seeing contract disagreements like this all over the country, and she blames it on 2 things. 1, consolidation of the marketplace. That's when we see mergers involving 2 major companies that provide similar services. And 2, inadequate network standards. That's when your insurance plan does not give you enough access to providers in your area. Coyle goes as far as saying that just like surprise billing, this is the new issue in the healthcare debate. And the only way to fix it is the same way we fix that, through legislation.
Something like that needs to happen in this case. That disagreement should not leave 400,000 people without access to their trusted provider or needing to travel a long distance to get a network care.
Care that for those like Mason Lang can mean life or death.
To think that you're throwing people's lives up in the air over dollars, it just infuriates me to no end.
Rachel Polanski, CBS 46 News.